Good evening, esteemed faculty members and all the delegates. Thank you for joining. This is Sahiti on behalf of Shield Connect, welcoming you all for today's webinar, Osteoporosis Management, Bone Health, organized by Chennai Menopause Society. So it's my privilege to introduce the MOCs of today's webinar, Dr. K. Anupama ma'am. Ma'am is the Senior Consultant at Savita Medical College and Hospital, and ma'am has more than 15 plus years of experience in this field. I welcome you, ma'am. And the other MOC is Dr. Deepika. Ma'am has been the medical officer at Subiksha Nursing Home and a medical officer at Isabella Hospitals, Mylapore, Chennai. I welcome both the doctors and I hand over the session to them.
Thank you, Sakiti. It's me, Dr. Deepa Tangamani. I'm the Secretary of Chennai Menopause Society. It's my honor to start the session. Today's session is on osteoporosis, bone health. We have three distinguished speakers. We're going to speak about all the bone health. And to welcome this webinar, may I ask Premlata Madam, our President Chennai Menopause Society, to welcome the gatherings. Madam was past President Oxy 2022, current President 2025 to 2021 Chennai Menopause Society. She is a consultant, head of department of Mehta's multi-specialty.
Okay.
Over to ma'am.
Thank you. Thank you, Deepa. Good evening to one and all. It's my immense pleasure to, as a president of the Chennai Menopause Society, to welcome you all for this interactive webinar on osteoporosis management and bone health. I'm really very privileged to welcome our chief guest, Professor Atul Munshi Sir, on this occasion. He has joined us and he has accepted our invitation and he has joined us. Sir, we are thankful to you for your having accepted our invitation. He was the past president of IMS, editor-in-chief of Journal of Midlife Health, and he was the IMS representative to APMF and IMS representative to CAMS. And he was very much interested. So he is very much interested in menopausal women's health. I'm really happy, sir. Welcome you to the webinar, sir. I welcome Dr. Lakshmi Ratna Mahani. She's as a guest of honor. She's the vice president of Hyderabad Society, Menopause Society. She was the past president of Hyderabad chapter IMS, and she was the chairperson of quiz committee IMS, and she is a credentialized menopause practitioner and very much interested in menopausal women's health. And I'm very happy that you have joined us today as a guest of honor, ma'am. I thank all the esteemed faculty who have joined us. Professor Kannan, who is the head of the Department of Internal Medicine, Savita Medical College, and VP, Vice Principal, Savita Medical College. I welcome Dr. Irivarasan, who is the orthopedic professor in Savita Medical College, and other speakers who are joined us, Dr. Karthika Prabhu and Dr. Jayarani, to enlighten us today on this thing. Apart from this osteoporosis management, we have added one talk today on behalf of the FOXY, No Violence Against Women Today, that is meant to end violence, how to end, to understand digital violence against older women. That will be delivered by Dr. Jayarani. So I welcome one and all for this and all the participants who have joined here for this webinar, and it will be a very interesting thing. Thank you, sir. Thank you. Deepa?
Thank you, ma'am. Thank you, ma'am. So we'll start the gathering with Tamil Nadu, our
Tamil Thai Valth.
Tamil Thai Valth.
திலக
we'll proceed with the Now I'll just move on with our CMS prayer. We pray to God to give us grace to accept the midlife physical changes and gently renew our strength. Guide our heart, our mind, and body to navigate the way and our trust in you to lead us safely through. We pray for midlife mature women and who cherish the fond moments of their life, and also for those sitting in the doctor's office or who are in bed asking for healing touch. On this day, may all the midlife and menopausal women have the gift of joy, hope, and good health. Thank you, God, for the promise of hope you hold out to all midlife and menopausal women and inspire us to give this gift of hope to others. Thank you. So, it's short inauguration. I'll introduce Dr. Atul Munshi, our chief guest today. He's a consultant obstetrician and gynecologist director at Munshi Group of Hospital, Ahmedabad, Gujarat, India. He's also a former professor and HOD at GCS and NHL Medical College, Ahmedabad. Sir is an editor-in-chief and Journal of Midlife Health, and he's a president IMS 2010. And
Deepa,
IMS
that's okay. Deepa, that's okay.
Yeah, thank you,
That will
sir.
be fine.
Just
Dr. Premlata has already introduced me. Thank you.
Sir, can you give your wisdom of advice to us, chief guest address?
Sure. Dear Dr. Premlata, Dr. Deepa, my colleague and old friend, Dr. Lakshmi Ratna, learned chairpersons, esteemed faculties, distinguished colleagues, and members of the Chennai Menopause Society, very active society of menopause, Indian Menopause Society. Good evening. When Dr. Apsiba called me for this webinar by Chennai Menopause Society, I had no option but to say yes, because of two reasons. First, because of Dr. Apsiba, and secondly, Chennai is the place where I was installed as IMS president in 2010. It is both an honor and a privilege to join you today for this meaningful scientific program. Change is not challenges. I like this very much. The very title reflects the spirit of which of Menopause Society should be approached not as a hurdle, but as a transformative phase in a woman's health journey, which you already mentioned in your prayer. Today's session addressed some of the most relevant topics in the current menopausal care by eminent speakers. The gut-bone axis, a rapidly growing field, clarifying how microbe health influences bone and metabolism, bone and muscle health, the foundation of our functional ability to body, which is also very relevant, and the new era of anabolic therapies, marking a shift from merely preventing bone loss to actively rebuilding it. Today we are going to hear very nice topics about it. Wishing you all a productive and meaningful evening. I'm sure at the end of the session, we all will go with newer insight in the subject of bone health. My thanks to all office bearers of the Chennai Menopause Society for involving me in this interesting academic program. Thank you.
Thank you, sir. Thank you so much. It's very kind of you. Let me introduce our guest of honor, Dr. Lakshmi Ratna Marakani. Madam is a senior consultant at Ankura Hospital for Women and Children, Attapur, Hyderabad. She is a joint secretary to IMS 2021 to 2022, laparoscopic surgeon, and has an advanced ultrasound colposcopy training from Sheffield, UK. Madam is a credentialed menopause practitioner. She is a past vice president of UPIA Hyderabad and current executive member of UPIA, current vice president of Hyderabad Menopause Society. Over to you, madam. Over to you, madam.
Yeah, thank you very much. At the outset, I would like to really congratulate the Chennai Menopause Society. As Sir has told, that's very active society always. And the mere introduction, the song really was a very novel idea. Whosoever it is, really, it was very nice. And the topics are also, as Atul sir has said, really nice because this is the need of the hour. We all know that about 60 million people in India are suffering, and out of it, 80% are women population. And we all know that about 10 to 20 years before only, when we compare with the Western counterparts, we get osteoporosis, which is a very silent disease. So we all should bring up still more awareness in our general population. And of course, within our doctor population, but general population, it is very much needed, and we all have to go a way forwards and teach them and what are the preventive aspects. Once it is settled down, not much we can use, but prevention measures we have to talk about. And this latest aspect of this gut microbiome has coming up very much. We never knew that. That's why our elders are so very good, because they were using all fermented food and probiotics early morning, the curd rice or whatever rice, which is full of probiotics. Now we know the link between the bone and the gut microbiomes, which are changing with all the short chain fatty acids, so many of the granulocyte factors, so many things have come up with the gut microbiome, going through the bone, brain, every aspect of the human health now is dependent on the gut microbiome. So you have really chosen a very good topics. So let us listen to all the famous people who are going to enlighten us, so that we will enlighten our general population later on. Thank you once again, Hepzibah, who has actually invited me as a guest of honor. Thank you very much. The entire team working behind the screen for any CME, there are many people behind the screen. So thank you one and all. Thank you, Dr. Premlata.
Thank you, madam. Thank you so much. It's very nice. Madam, we will move on to the next scientific session. Premlata, madam, is it okay? I will hand over to Dr. Deepika. Deepika, are you there?
Yes, ma'am. Yes,
Okay,
ma'am. Good
please.
evening, ma'am.
Presence, ma'am.
Yes. Thank you, everybody, ma'am. Now, I'll move on to the program and I'll introduce our chairpersons for today. Dr. Geeta Lakshmi, ma'am, Professor of Obstetrics and Gynecology at Sri Balaji Medical College and Hospital. Welcome, ma'am. She's a senior consultant OBGY and a past secretary of OPSI. She has done her UG and PG in Madras Medical College, and she's done a UG and PG teacher for the past 24 years. She has several memberships, including Chennai Menopause Society. She's had done many research and publications, and her areas of interest include high-risk pregnancy and adolescent health programs. Welcome, ma'am. And I would like to welcome our other chairpersons, Dr. Ramani Rao, ma'am. She's a senior consultant in Chennai. She's done her MBBS in Stanley and her PG DMCH gold medalist 1999. She's received the Best Doctor Award in MGR Medical University. She's a lifetime member in OPSI and FOPSI and member of IME, ISOPARB and PCOS Society. She's a faculty at numerous national and international conferences, renowned for expertise in women's health, counseling, and reproductive medicine. Currently, she's a senior consultant based in Ambattur, Chennai, giving compassionate care and clinical excellence. Lastly, I would like to invite our third chairperson, Mrs. Rajalakshmi, ma'am, Professor and Unit Head of Department of OBGY in Savita Medical College. Has guided and mentored many UG and PG students. She's a provider and instructor in advanced life support in obstetrics. She has done advanced diploma in ART and reproductive medicine, University of Schleswig-Holstein, Kiel, Germany. She is also an executive member of Chennai Menopause Society. I welcome all our chairpersons.
Thank you, Deepika, for your nice introduction.
Thank you, Deepika, for the nice introduction. So, Deepa, can we go on to the scientific session?
Yes, madam, please introduce the speakers, ma'am.
Yes. So, it gives me an immense pleasure to be a chairperson of this CME organized by the Chennai Menopausal Society, and it is concentrating on bone health. And without wasting much of our time, we will go on to the scientific session. And I would like to introduce the first speaker, Dr. R. Kannan. And sir is he is the professor and HOD of General Medicine and Vice Principal of Savita Medical College, and is a principal investigator in 12 clinical trials, and he has got various research publications, and he has got 28 awards in national and international conferences, and he has got an Excellent Service Silver Award from the Government of Singapore. So we welcome you, sir, and sir is going to concentrate on gut and bone axis and how microbiomes are going to influence the skeletal health. So over to you, sir.
Sahiti,
Yes, ma'am.
can you display this?
Kannan, sir?
Sahiti, sir is there, no?
Yes,
Sir
ma'am.
is there, madam.
Yes.
Yeah, stop. Good afternoon, one and all. My topic is gut-bone axis role of microbiome. It's a new topic. We are going to link the gut and the bone and how it is going to be related to the health. The overview will be what is the concept of gut and bone axis and what is the interaction of the gut and bone along with the microbiota, immunity, and particularly related to the bone health, and that is what I am going to discuss. Next slide, please. How the microbiome health influences the skeletal strength. It's actually a new area of interest, which we are not aware. It's a new emerging concept which is coming up. Next slide, please. Next slide. Yes. Actually, what happens, we eat a lot of food and we have genetic background, we have lifestyle modification, we have age-related factors. All will contribute to the gut microbiota. That is a new concept. This gut microbiota, in addition, what it does is it regulates the function of different organs in the body, particularly the nervous system, the metabolics, the reproductive system, bone health, and GIT. That is the main important thing. Next slide, please. How it does? Basically, what happens? From the gut, lot of bacteria are there, viruses are there, different organisms are there. All will enhance the bone growth via IGF-1 upregulation. That is the emerging concept. For example, you can see here, the IGF-1 is acting through IGF binding protein and it improves the bone health. And I will talk about that in detail in the next subsequent slide. You can see a lot of bacteria, lactobacilli, bacilli, different bacteria through the gut. It increases the IGF. That is a basic fundamental which causes the bone growth. And IGF-1 upregulation and signal amplification may be one of the target for the treatment in the coming future. Next slide, please. You can see here, this is a very good slide which shows the basic concept. Normally what happens, the healthy intestinal microbiota will be there and intestinal lumen will be preserved. So there is a balance between the gut and microbe. There is a very healthy balance. There is a mucus layer, there is a tight junction, there is a gut epithelium, everything. Here what happened, there is a dysbiosis. There is a change in the microbiota and the mucus layer is changed. Intestinal integrity is changed. So what happens, the pathogens will cause a lot of disturbance in the body and it causes different effects along with the immune system, along with the hormones, along with the different factors in the body, which causes the health to the disease. That is the emerging concept. Next slide. This is the old slide. You can see here, previously different bacteria will act through different system and it causes the bone resorption and formation. That is the old concept. Next one. Next slide. Now this is a very good slide which depicts everything. This is a very, very new concept. You can see here, there is a thing called brain, gut, and bone axis. There is a thing called gut, liver, and bone axis. These two are emerging concepts. For example, from the brain through the hypothalamic pituitary axis, it acts through the gut, and the gut-bone axis is activated. How it acts, I'll go into the level next. Then there is a thing called disc axis, gut musculoskeletal system axis, gut bone axis through the hematopoietic system through different bones. So we have a entirely different spectrum which goes through the brain, gut, and bone, gut, liver, and bone. Next slide. So there are trillions of bacteria in the GI tract which regulates the metabolism, which regulates immunity and inflammation. So the normal biosis is changed. This biosis causes all the effects. I will go into the basics how it is produced. Next slide. You can see here it causes different dietary factors, different probiotics, prebiotics, everything. It affects the SCF. SCF is short chain fatty acids and the immunomodulation and the different. This I will go into the depth. Next slide. You can see a lot of research is going on in the human, in the animals. Particularly, they have done a lot of research in the human, bifidobacterium and lactobacillus. These two are commonly seen in the human beings. It causes significant increase in the height. That has been proven. But mice and the chicken, there are different bacteria which is being going on. Research is still going on. Many of them causes bone formation. Many of them causes increasing the femur length. Still, we wait for the report. This is very, very primitive in the now at present. Maybe we get in future the details. Next slide. You can see here, now we go to the basics, how the bone formation occurs. There is a role of osteoblast and osteoclast. Osteoblast is bone formation, osteoclast is bone destruction or resorption. It is regulated by the hormones and cytokine nutrient. This is the old one. These are interlinked or modulated by the gut microbiome. How these are linked, that we will see how it is impacted by the systemic inflammation. Next slide. You can see here, nutrient absorption is calcium, vitamin D, vitamin K, and SCF, that is short chain fatty acid, promotes osteoblast. Immunomodulation causes bone resorption, reduces bone resorption. Gut permeability is very, very important. Whenever the gut permeability increases, there is an inflammation and bone loss occurs. So we have to target this increased gut permeability to reduce the permeability so that inflammation is reduced, bone loss is reduced, so that osteoporosis is prevented. So all the four are linked. Basically, the nutrition, the bone formation, bone resorption, gut permeability, all are interlinked. Next slide. So we have short chain fatty acids, particularly butyrate, acetate, propionate. It enhances the osteoblast differentiation and it reduces the osteoclast so that the bone desorption is reduced, so that bone formation is good, so that the bone preservation occurs. Next slide. You can see here, whenever the harmful bacteria is more, beneficial bacteria is less, what happens? The height is reduced and the linear growth is reduced because the basic fundamental concept, reduction in the short chain fatty acids and increase inflammation, increase gut permeability. Next slide. Very good slide. You can see the SCF, short chain fatty acids, the key regulator, very, very important key regulator. It acts through the hormones, it acts through the inflammation, it acts through all the cytokines so that the bone formation is more, the osteoblasts are more, the bone formation is more, so that bone growth is preserved and growth plate is increased through IGF. So all are interlinked. For our understanding, we are dividing into nutrition, we are dividing into IGF, we are dividing into short chain fatty acid, immunology, cytokines, everything. So all are interrelated. All play a very, very important role and each one plays a very, very important. That is the understanding. Next slide. The gut, now we go to gut permeability. Leaky gut. What does leaky gut produces? Leaky gut produces lipopolysaccharide levels are increased and it stimulates all the cytokines which are harmful. It promotes bone resorption. So we have to target this so that this gut permeability should be reduced. Then the bone preservation occurs. Next slide. Next one. Normally what happens? The intestinal permeability is increased so that what happens is You can see here, high intestinal villi, enhanced digestive absorption, calcium, phosphate, magnesium, everything is increased. So this is good. So increased permeability, leakage causes massive release of cytokines. So osteoclasts are increased. So what we have to do? We have to modify this. How? Through the gut microbes. What happens? These, they derive mediators. So what happens? IGF is increased, lipopolysaccharide is reduced, short chain fatty acid is increased, so that all the beneficial effects come, so that it promotes osteoblast and it causes reduction in cytokine and increased bone formation, and the opposite effect, that harmful bacteria causes osteoclast formation and increased bone resorption. How it happens, I'll tell you the next slide. So we should have a balance. The intestinal permeability reduced and gut microbiota should be increased, so that there is a balance, so that bone formation is more, resorption is reduced. That is the understanding between the gut permeability and the microbes and the cytokines. Next slide. So we have IGF, we have parathormone, we have estrogen. These are all hormones which are basically influenced by the microbes. That is a new concept. And altered hormones causes altered bone turnover. So that we have some cytokines which are very good, which we have to promote. Some cytokines are not good. That has to be reduced. Next slide. We can see so many hormones are there: ghrelin, GIP, GLP-1 analogs, all the gut hormones. You can see here, ghrelin increases the bone formation, increases the bone destruction, right? GLP-1 increases bone formation, GIP increases bone formation, right? So still the research is going on. The gut hormones are considered to remodel the bone. Some are active in the bone formation, some are active in the bone resorption. Lot of studies still going on. It's a very basic fundamental study. Still it is going on in the human and rodents and animals. Next slide. You can see here one more concept is what is probiotic, what is prebiotic, what is symbiotic. Probiotic means a live bacteria, which is like example we call seeds. Prebiotic means non-digestible fiber, which are called fertilizer. This is a food for the seed. So we have to combine probiotic with a prebiotic. This combination is called a symbiotic. So we give a bacteria, lactobacilli, that's a seed, right? Prebiotic, we add non-digestible fibers like fertilizer for the food, so that these two will act together, so that this causes symbiosis, so that dysbiosis is reduced. So prebiotics and probiotics are combined to give symbiosis. This symbiosis reduces the dysbiosis, so that the gut microbe will have a very good effect in the body, and it has a particularly good effect in the bone. Next slide. You can see here the prebiotics example: inulin, FOS, and short chain fatty acids. Probiotic is lactobacilli and bifidobacter. These two are proven, very clinically proven, and Mediterranean diet is also very, very beneficial. Next slide. You can see animal studies, probiotics improve the BMD. Human trials, very, very modest, but positive effects are still there, and it may be a potential adjunct in osteoporosis management in the near future. Next slide. So we can see here the probiotic increases the gut microbes, and animal studies have been proven and clinically promising may complement traditional bone growth interventions, right? And prebiotics, widely available potential as dietary supplements, which is being used. A lot of studies are done. It produces ACF, short chain fatty acid, activate IGF, activate growth hormone, all modulate the hormone, enhances the mineral. They are like a fertilizer for the seed, which is probiotics, right? Prebiotics are fertilizers, probiotics are the seeds. Next slide. Next one. Next slide. You can see here the interrelated. These are all different. I want you people to concentrate on the T regulator cell and T helper cells, right? These two play a very, very important role. A lot of things are these are all in research. It's going on. So I want you to concentrate on the T regulator cell and T helper 17 cell. What happens in the osteoblast and osteoclast? Next slide. You can see here lot of information. You can see the probiotics, bifidobacterium, lactobacilli, prebiotics, dietary modification, gut microbiota, different things, right? Very, very complex, right? Next slide. Here, the important thing is, even though we read separately the immunology, the nutrition, the hormones, all are interrelated and working together along with the gut microbes. For example, microbe-derived components, it's very useful. Intestinal permeability alteration, T helper cell regulation, they call gut immune bone axis, direct gut bone axis, and gut endocrine bone axis. These are all emerging concepts in the gut, bone, and microbe axis. So we have gut and bone, we have gut immunology and bone, gut endocrine and bone. Example, gut bone is microbes. Gut immune is T helper and T regulator cells and macrophages and lymphocytes. Gut endocrine topic is estrogen, serotonin, parathormone, vitamin D, vitamin K, right? So probiotics and prebiotics can be given in osteoporosis. We can use nanoparticles. We can use a lot of engineering materials. Right? They play a very, very important role in all these areas. Next slide. Next one. These are all some of the good references. You can have a look. Next. Next. Next one. Next. Next. Yes. Now, we'll finally touch upon the T helper and T regulator cell. What happens? We have already discussed the short chain fatty acids and CD4 cells, right? This short chain fatty acids and CD4, they activate T regulator cells and T helper cells, right? T regulator cells produces anti-inflammatory cytokines, right? IL-10 and IL-35. It causes bone formation. T helper 17 cell causes pro-inflammatory cytokines, IL-6 and IL-7. So there is a balance maintained between the T regulator and T helper cell. These two are basic concepts. Coordinating with the SCF, short chain fatty acids. So it causes the bone formation, reduction in the bone reabsorption. Next slide. Next one. Yes. So finally coming to the important part, the T helper cells will go through the osteoclast. T regulator cell will go to the osteoblast so that the bone formation is increased, the bone reduction is reduced. Next slide. Final 2 or 3 slides. So basically we need to have more osteoblast and reduction in the osteoclast so that we have less bone loss and more bone formation. So this T regulator is very, very important for promoting the bone formation. The T helper 17 should be reduced, the level should be reduced so that we have bone loss, it can be reduced. Next one, what are the therapeutic implications of this? Next one. Next one. Next. Next slide. Next one. Yes, you can see here all the probiotics on human outcome studies, all are taken in the recent 2025 articles. You can see here, they have done lactobacilli, they have done bacillus subtilis, lactobacilli, streptococcus lactobacilli, all has been studied in different population in distal radial fracture, postmenopausal women with the knee OA. So they have done and they have compared. So what they found is the effect is very good through different mechanisms, right? Basically, you can see, for example, you can see here TNF alpha, IL-6, IL-12, IL-10, like that different things are going on. So there is a definitive proof with the gut microbiome, with the hormones, with the nutrition, with the immunology, with the cytokines. Okay, now how we are going to use this in our practice? Next slide. Last 2 or 3 slides. I'm going to talk about using in practice. Next slide. Okay, you can see here the bone formation. We want more bone resorption should be reduced. So, for example, some bacteria are very useful through IL-6, IL-4, IL-10, TGF beta, right? So, bone formation is more and bone destruction should be less. Next one. Next one. Next. What are the therapeutic implications? We can give probiotics, we can give prebiotics, we can give combination of pre and probiotics. We can target the dysbiosis, we can personalize the microbiome. There is a new concept called fecal microbial transplantation. Fetal microbial transplantation. Yes, next slide. Next one. Okay, you can see the final 2 slides. So, finally, what gut microbiota is doing, it acts through the immune system, activate the T helper and T regulator cells. It activates the endocrine system, estrogen and parathormone, short chain fatty acids, and extracellular vesicles, finally causing the bone formation, which is more, and bone resorption is reduced. So this gut microbiota play a very, very important role in the nutrition, in the metabolism, in the endocrine and immunology. Next one. Yes, this is the last slide, I think. So individuals with osteoporosis, right? We have to reduce the intestinal barrier permeability. That is, intestine permeability is reduced means the gut microbiome will play a very, very important role, right? So we have to adjust the gut microbiota. So short chain fatty acid should be increased in the body. Lipopolysaccharide should be reduced. And T helper 17 should be reduced. T regulator cells should be increased. And inflammatory cytokine should be modified. IGF should be increased and exercise. All these things are going to be the future in the treatment of osteoporosis, and it increases the bone formation and reduces the bone resorption. Next slide. So, for example, they have done a study. A patient underwent gastric bypass. After some time, they found that BMD is reduced and the disturbed gastric acid through the different things. So, they definitely say that the gut plays a very, very important role in the modulation of bone. Next one. So summarizing everything, there is a new entity which is coming up in the future, which is linking the gut and the bone and the microbiome. All the three are interrelated. It plays a very, very important role in the skeletal strength, even though it plays a very, very important role in different parts of the body. The microbiome is basically a thing which links the gut and the bone. It influences the inflammation, reduction in inflammation, increasing the hormone activation, increasing the nutrition, and it may be emerging therapeutic frontier in the future. That is the take-home message. Take-home message is all the gut microbiome, that is prebiotics and probiotics, are going to be very, very useful, and it may be tried in many aspects so that the side effects are less, complications are less, and it is a beneficial to the body. It may have a multiple effect in the body, and it definitely will go a long way in the health of the human beings, and it prevents, maybe in future, it prevents the osteoporosis. It may be very useful. Right now, it is useful in increasing the bone formation. Research is still going on. We may need more research, more studies, more papers, more knowledge. We may have to have more knowledge. Now the knowledge is very, very embryological in this aspect. It's a good topic. Thank you once again.
Thank you, sir, for the excellent session on gut microbiome. Your talk was very inspiring, and we appreciate your time and expertise, sir. Thank you, sir.
Thank you, madam.
We'll move on to the next speaker. It gives me immense pleasure in welcoming our next speaker, Dr. Kartika Prabhu, ma'am. She's the professor in SRM Medical College, and her special interest. She has special interest in high-risk pregnancy, gynec endoscopy, and midlife health. She has achieved several awards like Dr. A.V. Umachigai Memorial Gold Medal Award, Dr. Asha Bakshi Award. She has received gold medal in Research Day from SRM in the year 2020. She has received Dr. A.L. Mudalia Traveling Fellowship Award. She has more than 30 national and international publications. She is faculty in national and regional conferences. Over to you, ma'am. She's going to speak on bone.
Good evening, everyone. I am not able to share the screen.
1 second. Yes, ma'am. Please check.
No, I am not able to share.
All the panelists have access to share the screen, ma'am. May I know what error it is showing, ma'am?
Mute website notifications while sharing. Select window or screen.
Yes, ma'am. You need to select any your PPT tab and then again click on share option.
Okay, is it visible now?
It's loading now. It is showing like Kartika ma'am has started sharing. No, ma'am. Can you please try again, ma'am? Can you please try again, ma'am?
I'm trying. Shall I send the PPT to our
Yes,
WhatsApp?
yes, ma'am. Yes, ma'am.
Shall we go on to the next speaker, ma'am? And come back afterwards?
Madam, this is Dr. Elavarsan.
Yes.
Yes, hello,
Please,
madam.
yes. CV,
Yes,
just project and tell her, pa.
I'm just
Yeah,
stuck in
yes.
traffic, madam. Can you just share my slide that I've sent to you, madam?
Yeah, I have it, sir. I thank the CMS team for inviting me to be the chairperson for today, and it is my immense pleasure to invite Dr. MD Elavarsan, who will be talking to us on beyond bisphosphonates and osteoporotic management. Dr. MD Elavarsan, he is a pediatric orthopedic surgeon with specialized training in deformity correction, hip preservation, and limb strengthening. Strong focus is on compassionate, patient centered care combined with advanced surgical expertise and experienced in academic teaching, clinical research, and multidisciplinary collaboration. He's done his MS orthopedics in 2018 and fellowship in pediatric orthopedics from Ganga Hospital, Coimbatore. He is currently the consultant and associate professor of pediatric orthopedics at St. Isabel's Hospital and Savita Medical College and Hospital. So the key skills he's having are pediatric orthopedics, deformity correction, hip preservation, limb strengthening, advanced surgical skills, clinical research, and teaching and mentorship. So over to you, sir.
Thank you for the warm welcome, ma'am. Can I have the slide, ma'am, please?
Yes, sir. Just now I have received. Kindly give me 1 minute
Yes,
to download the slides and share it.
Yes, ma'am. Yeah,
So
I
we
can.
all,
Yes,
yes,
ma'am. I
sir.
can see the slides. Are you all able to see, madam?
Yes,
Yes, sir. Yes, sir. We are able to see.
Just forgive my background noise. I'm stuck in traffic. So I would like to thanks for giving me the opportunity to the Menopausal Society of Madras and Dr. Anupama ma'am for inviting me. So the topic is on management of osteoporosis and in particular about anabolic therapies. So I would like to give a overview of osteoporosis management. Then I would like to talk about the anabolic treatment methods. Is it okay for you?
Yes, sir. Yes, sir.
Yes, ma'am. So osteoporosis is characterized by low bone tissue. 1 second, ma'am. Am I audible now?
Yes, sir.
Yes, sir.
Yes, ma'am. So osteoporosis is characterized by low bone mass and microarchitectural deterioration of bone mass, leading to enhancing bone fragility and increased fracture risk. The next slide. So for screening, we have few investigations. The most commonly used investigation is a DEXA scan. And for screening, all women aged more than 65 years old and men over 70 years of age should undergo a DEXA scan. And in younger patients with special populations such as patients with rheumatoid arthritis, hyperparathyroidism, COPD, celiac disease, and patients on glucocorticoids, anticonvulsants, and protein pump inhibitors can have the DEXA scan when they are between 50 to 64 years of age. Next slide. So what DEXA scan does is, it gives us the measurement of bone mineral density, it gives us the volume of bone mass, and it also gives us a predictor of fracture risk. And it gives us two scores. One is a T score, the other one is a Z score. T score is used for older adults, and a Z score can be used for younger individuals. Next slide. So this is what we get in a DEXA image, and it has to be categorized in three forms. Madam, next slide, please. So according to the WHO classification, patients fall under severe osteoporosis when the standard deviation is less than 2.5. Next slide. So the uses of DEXA scan is that it gives us a detection about the risk for bone fractures, to confirm the diagnosis of osteoporosis in those with a fracture, to determine the rate of bone loss, and to determine response to therapy. Now this is a new tool that has come. This is devised by WHO. This is called as the FRAC scale. So here it gives us a combination of both bone mineral density and includes some clinical risk factors to predict fracture risk better than the either alone. So it is better than using only bone mineral density. It has the combination of both DEXA scan, and this scale will give us a better prediction, around 10 years probability whether the patient will develop a fracture within the next 10 years. The next slide. So these are the FRAC risk factors. These risk factors, can you go to the next slide, please? So this is an online tool. This is, here you have to enter the patient's detail. Some risk factors are given here. All risk factors, whether if it is present, you have to give a yes. If they are not present, you have to give a no. After which it will give us a score. Based on the score, the threshold for treatment can be started, and it will give us a predictability of fractures in the next 10 years. Next slide. And T score is used for postmenopausal women and men, and it is used to determine if the patient has osteoporosis and whether treatment is required. And Z score can be used for premenopausal women. Next slide. So this is the National Osteoporosis Foundation treatment guidelines, and they have given as a guidelines to find out for whom the treatment has to be given. So after exclusion of secondary causes, we have to give treatment for postmenopausal women and men above 50 years of age with a clinical diagnosis of a previous hip or spine fracture, and a DEXA diagnosis T score of more than -2.5 or below in the spine or hip. And if the patient has a T score between -1 and -2.5, a 10-year risk of fracture can be assessed if the patient is having a more than 3% for hip fracture on FRAC scale, or more than 20% for a major osteoporotic fracture on FRAC scale. Then the patient should be given a treatment with treatment for osteoporosis. Next slide. And there is another test. This is called as the quantitative CT scan. Patients are put under a CT scan, and we measure the quality of the vertebra on a CT. Next. There are a few other tests that has to be done before putting the patient on treatment for osteoporosis. Some of these are this. One is you have to assess the kidney function, calcium levels, serum vitamin D levels, and 24-hour urine calcium. Next slide. We have to also assess for parathyroid hormone if you are going to give an anabolic agent such as the teriparatide, because teriparatide and parathyroid hormone are symbiotic, and they will cause hyperparathyroidism. And also check for, in men, we have to check for testosterone levels and 24-hour urine cortisol levels. Next slide. The pharmacological management is to prevent fractures, to stabilize the bone mass, or to achieve increased bone mass, to relieve the symptoms of fractures and skeletal deformity, and to maximize physical function. So these are the various treatment options available. One is to prevent, we can give estrogen. And for treatment, we can give calcitonin, parathyroid hormone, denosumab or romosozumab, and in between we have the alendronate, risedronate, ibandronate, zoledronic acid, and raloxifene. All these are bisphosphonates. Until zoledronic acid, it is a bisphosphonate. So there are two treatment options available. One is an anti-resorptive mode. The other one is an anabolic therapy. The function of anti-resorptive is to decrease the bone resorption, and most of the agents that are available in the market are anti-resorptive agents, and the newer form is the anabolic agents which stimulate bone formation. One of the few examples is the teriparatide. So coming to bisphosphonates, they are analogs of pyrophosphate. They are used as a first-line therapy for the treatment of osteoporosis, along with lifestyle modification. And along with bisphosphonates, we have to give appropriate levels of calcium and vitamin D supplementation. Next slide. The indications are to treat and prevent postmenopausal osteoporosis, to prevent and treat glucocorticoid-induced osteoporosis, and treatment of men with low bone mineral density. Next slide. So I think all of you know the action of bisphosphonate. I'll go to the next slide. So the doses for bisphosphonates are usually what we prefer in clinical practice is if the patient is admitted, then we give a zoledronic acid 5 mg by intravenous infusion over a minimum of 15 minutes. Over once a year it is given. If the patient prefers oral agents, then we give alendronate or risedronate. The doses of alendronate, it is 70 mg weekly, and for risedronate it is 35 mg weekly. Next slide. Before starting the bisphosphonates, we have to avoid the patient if the patient is then having hypocalcemia, because bisphosphonates can cause tetany, and we have to also check for RFT levels. And for oral dosing, esophageal stricture or impaired esophageal motility, and patient should be, if the patient is unable to stand or sit for at least 30 minutes, it is better not to give bisphosphonates. UGA symptoms as such are not a contraindication to oral dosing. Next slide. The side effects are UGA symptoms, influenza-like symptoms, infrequent bone, joint and muscle pain, jaw osteonecrosis, atypical fractures following long-term therapy. Long-term treatment with bisphosphonates can cause jaw osteonecrosis, so we give a break in between. This is called as bisphosphonate holiday. A drug holiday of 1 to 2 years is given after a period of 5 to 10 years of treatment. Next slide. Coming to anabolic agents, teriparatide is the most commonly used agent. This is a bone forming, this is a recombinant fragment of human parathyroid hormone. It contains first 34 amino acids from the N-terminal end, and it is an osteoanabolic agent. It helps in bone forming. Again, the indications are postmenopausal women with osteoporosis at high risk for fractures, steroid-induced osteoporosis, men with primary or hypogonadal osteoporosis at high risk for fractures, and bisphosphonate failure. The mechanism of action is, once we administer the teriparatide, it binds to the parathyroid hormone 1 receptors on osteoblasts, activates the cyclic AMP, stimulates osteoblast activity and survival, promotes new bone formation, reduces osteoblast-induced osteoclast activation through Rankel modulation. Next slide. So this is one of the papers that has given that it has a good efficacy in preventing new vertebral fractures. Next slide. So the dose is 20 micrograms subcutaneous daily. The duration of treatment is 2 years. And bisphosphonates and teriparatide should not be combined together. This will reduce the potency of teriparatide, and the off life is around 1 hour. It is excreted by the kidney, so we have to be cautious in giving this drug to patients with renal issues. And it is better administered in sitting or lying position. The other form of anabolic agent is romosozumab. This is newly developing. It is a humanized monoclonal antibody that targets sclerostin, a protein for treatment of osteoporosis. Next slide. Calcitonin is given intranasal through nasal route, and it prevents osteoclast activity. The dose is 200 international units daily. It is most of the times combined with bisphosphonates. Next. And denosumab is a Again, one of the newer drugs for treatment of osteoporosis. This is a monoclonal antibody to RANKL receptors. It is given 60 mg subcutaneous injection is given every 6 months. The advantage of this is this can be given, one dose can be given every 6 months. But the problem with teriparatide is it has to be given every day. So this is a slighter advantage if patients are not compliant with our treatment regime. And when few reports have shown that there is an increase in spinal BMD after 3 years in the few trials, and 8-year data shows that there is continuous increase in bone mineral density, reduced bone turnover, and there is a good safety. The problem with the denosumab is if the patient discontinues, there will be rapid resorption of bone. Next slide. The adverse effects are field infections, skin infections, dermatitis, eczema, and rashes. Patients sometimes can have back pain, pancreatitis, osteonecrosis of the jaw, and significant suppression of bone remodeling. Next slide. This is the current concept that has emerged. This is called as the sequential therapy. So here, instead of giving any one particular drug to a particular patient, a sequence is followed for all the patients with osteoporosis. Initially, the patient starts with a teriparatide. After giving teriparatide for a few years, then we switch the patient to a denosumab or bisphosphonates combination. Once patients, if the patient wants to stop denosumab, then at least for 1 year we have to give bisphosphonates are recommended. And for bisphosphonates, we have to give a drug holiday of bisphosphonates. Continuous calcium and vitamin D supplements should be given along with bisphosphonates. Next slide. But the most important management is non-pharmacological management is advised. Patients should be advised a proper diet, as sir told previously, and patients should be encouraged to undergo moderate amounts of physical activity. And it is important that patient avoids tobacco and alcohol consumption. Thank you.
Thank you, sir, for that wonderful presentation. You have very nicely put in that sequential therapy and where we can combine and give a holiday, drug holiday also. And most importantly, how you have put the diet and physical exercise as always the first line treatment. Thank you, sir. Thank you very much for enlightening us on this on anabolic steroids. Thank you, sir.
Thank you, ma'am. Thank you.
So next we can go to the Dr. Kartika Prabhu. Have your slides are ready now?
Yes, ma'am. I have shared with the
Yes,
Sahiti.
ma'am. Yes, ma'am. I'm sharing the slides.
Good morning, everyone. Good evening, everyone. First of all, I would like to thank the organizers, Chennai Menopause Society, for giving me an opportunity to present here. My topic for today is bone and muscle health. We now know that estrogen is responsible for both muscle and bone health. So in menopause and in the perimenopausal period, deficiency of estrogen hormone affects the musculoskeletal health to a greater extent. So this locomotor disability, frailty, falls and fractures greatly affects the quality of life of the postmenopausal woman and also increases the mortality. Next slide. So previously we were thinking only osteoporosis is occurs in menopause, but now we know that not only that, muscle health affection, that is sarcopenia, is also common in the postmenopausal period. So the newer terminology which is used is musculoskeletal syndrome of menopause. A few research articles I saw with musculoskeletal syndrome, which comprises of all the three: osteoporosis, osteoarthritis, and sarcopenia. So the decline in estrogen level in menopause can cause weakened bones, that is osteopenia. It increases the inflammation. It decreases the satellite cells in the muscle, leading on to sarcopenia. All this leads on to musculoskeletal pain and discomfort. So collectively, it is called as musculoskeletal syndrome of menopause. Next slide. So what is the role of estrogen in bone health? So estrogen regulates the bone remodeling. That is, it decreases the activity of osteoclast. So there is decreased bone resorption. At the same time, it increases the osteoblastic activity. So there is more bone formation. So bone remodeling is decreased. the bone formation is increased, and there is decreased bone resorption. So estrogen protects the bone architecture. It maintains the structure of both the cortical and trabecular bone, thereby preventing microfracture and preserves the bone strength. Next slide. So as already sir has told about osteoporosis, that is low bone mass, that is microarchitectural disruption and increased skeletal fragility, and fragility fractures. Next slide. Or fractures which occurs with low or minimal trauma, and the most common site of fragility fractures are spine, hip and wrist. It occurs in cases of severe osteoporosis. Next. So there is a number of Indian women with osteoporosis is on the rise because of parallel increase in life expectancy. So the lifetime risk of fracture is around 40%, and the risk increases from 33% to 50% in women between 50 to 60 years. Next. Next slide. So how likely one develops osteoporosis depends upon how much bone reserve she has attained in her youth. So in this graph, you can see that in the female, the bone loss after menopause is drastic. So the peak bone mass is around 30 years, and the spinal loss starts from 20 years, and the femur bone loss starts by 30 years. So after menopause, there is 2 to 4% of loss per year for the first 5 to 10 years. So this point is important because any intervention we want to prevent osteoporosis and its related morbidity, we have to intervene in the first 5 to 10 years of menopause. Apart from that, there are few people who lose the bone at a faster rate. They are those with family history of osteoporosis, who have asthenic build, that is thin built individuals, who have premature ovarian insufficiency, who have surgical menopause, and who use smoking and alcohol. Next slide. Next slide. As I already told you, so the estrogen withdrawal causes unrestrained action of parathormone on the osteoclast. So there is more osteoclastic activity and more bone resorption. So especially the trabecular bone loss occurs, which is a characteristic feature of postmenopausal osteoporosis. Next slide. So not only estrogen deficiency is going to affect the bone, it also affects the muscle. So estrogen acts on the muscle both directly as well as indirectly. So it enhances the muscle protein synthesis. It causes satellite cell activation. It improves the mitochondrial function and energy metabolism. It reduces inflammation and oxidative stress. And it also supports the neuromuscular activation. So it is important for muscle health. So during menopause, there is decrease in muscle mass, especially type 2 muscle fibers, which are responsible for the power, that is strength. So there is decrease in muscle strength, there is decrease in physical function, that is gait, speed, balance, everything is affected, and they are prone for falls and fragility fractures. Next slide. Next slide. So the risk factors for osteoporosis are non-modifiable and modifiable. So the modifiable risk factors are the one which we have to act on to prevent osteoporosis. They are low BMI, so thin-built individuals, so calcium and vitamin D deficiency, malnutrition, smoking, alcohol intake, lack of physical exercise, and injudicious use of drugs like steroids. The non-modifiable risk factors are age more than 65 years, females, genetic predisposition, individuals with early menopause or with premature ovarian insufficiency, and menopausal status itself is a risk factor. That is, there is 2 to 3% of loss of bone per year. Family history of fragility fracture, personal history of fragility fracture, and ethnicity. So apart from the other, there are some secondary causes for osteoporosis like hyperthyroidism, Cushing's, use of steroids, chronic renal disorders, and malabsorption, which can predispose them for osteoporosis. So how we are going to assess the risk for osteoporosis and fracture? We have simple tools like OSTA and FRAX score. OSTA is for assessment for osteoporosis risk, and FRAX score is for assessment for fracture risk. Though these are easier, the gold standard method is dual energy X-ray absorptiometry, DEXA scan. Next slide. So osteoporosis self-assessment tool for Asian is a very simple tool used based on only two things. One is the current weight of the patient and the age of the patient. So this is weight in kg minus age in years divided by 5. Suppose the weight of the patient is 50 and her age is 60. So it will be minus 10 divided by 5, that is minus 2. So she will come under moderate risk. So based on the Oster score, so we can assess whether she's high risk for osteoporosis, moderate risk, or low risk. Next slide. So this is the graph which depicts whether she comes under low risk, moderate risk, or high risk based on the score. Next slide. Next slide. So next one is a fracture risk assessment tool, which is designed to predict the 10-year probability of hip fracture and major osteoporotic fracture according to the individual's clinical risk factors with or without bone mineral density. Already doctor has mentioned about this. So it's a simple questionnaire. So with or without bone mineral density also we can calculate the risk. Next slide. Next slide. So based on this, we can categorize them into low risk, high risk, and very high risk. So low risk require calcium and vitamin D supplementations. High risk individuals will require bisphosphonates, whereas very high risk patients will require anabolic treatment. Next slide. So DEXA scan is a gold standard to determine those having osteoporosis. It is preferred than plain X-ray because X-ray will show when more than 30% bone loss occurs. And lumbar spine and hips are the common sites to measure the bone mineral density. Forearm BMD can be used in obese individuals. Next slide. Next slide. So this already sir has mentioned. So the normal bone mineral density is when the T-score is between -1 to +1. So osteopenia is between -1 to -2.5. Osteoporosis is when the T-score is between less than -2.5. When there is associated fracture, it will come under severe osteoporosis. So for every 1 standard deviation fall in bone mineral density, the increased risk of fracture risk is 1.5 times in vertebra and 2.5 times in hip. Next slide. So DEXA scan is indicated in women more than 65 years. Women less than 65 years with risk of osteoporosis should undergo DEXA scan. Women with fragility fracture, women with menopausal transition with secondary causes for osteoporosis, patients with POI and early menopause, and when there is radiological evidence of osteopenia or vertebral compression fractures also should undergo DEXA scan. Next slide. So we also have some easy tool, that is calcaneal quantitative ultrasound can be used as an alternative approach for assessing bone health and identifying osteoporosis. Next slide. So sarcopenia is an age-related loss of muscle mass and muscle strength with low physical performance. Both sarcopenia and osteoporosis go side by side. So sarcopenia is caused not only by aging, so other activities that is decreased physical activity, loss of appetite, poor nutrition, obesity, estrogen hormone deficiency, all will predispose to sarcopenia. Next slide. So in the evaluation, like we saw for osteoporosis prediction, for evaluation of sarcopenia, we have a simple screening tool called as a SARC-F questionnaire. So based on that, we can make a probable diagnosis of sarcopenia. So in those individuals, we have to do assessment by muscle strength, that is grip strength and chair stand test. If it is low, then we have to suspect sarcopenia. So we can confirm sarcopenia only by muscle mass, which we can do by CT, MRI, or by DEXA scan. Once we confirm it, to assess the severity, we have to do the gait speed, tuck test, and the 400-meter walk test. So muscle strength will has a primary indicator, that is decrease in muscle strength will help us for the initial identification. And then we can do assessment by muscle mass, and then severity we can assess by muscle function test. Next slide. So this is the SARC-F questionnaire, which is a simple questionnaire which we can use in our outpatient to assess for sarcopenia. A score of more than 24, we can make a diagnosis of sarcopenia. Next slide. So diagnostic criteria for sarcopenia by EWG-SOP2 is, first is low muscle strength is a key criteria. So low muscle quantity, that is same thing. DEXA scan, we are assessing the muscle mass, and low physical performance, gait speed of less than 0.8 meter per second. Next slide. So for both bone and muscle health, lifestyle management is a key role. So balanced diet with adequate physical activity, exposure of with sunlight, adequate amount of sunlight, Avoidance of bone depleting agents like tobacco, alcohol, caffeine, and excessive salt should be done. Next. So we have to limit the intake of salt intake to 5 grams per day, and we have to decrease the caffeine intake to less than 3 cups per day. The protein intake should be 0.8 to 1 gram per kg body weight. And suppose there is sarcopenia, then the protein requirement is more. It is 1.2 to 1.5 gram per kg body weight. We have to encourage the patient to drink plenty of oral fluids. We have to encourage them to take lot of phytoestrogen rich food like lentils, kidney beans, Bengal gram, and soya bean. And she should be encouraged to take lot of milk, dairy products which are rich in calcium. So vitamin C rich fruits and vegetables should also be encouraged, which will enhance the calcium absorption. So the daily recommended intake of calcium is 1200 milligram per day, both in the form of diet as well as in the supplements. And vitamin D requirement is 800 to 1000 international units per day. Next slide. So sunlight exposure, previous slide. So minimum 15 to 30% of body surface area should be exposed for at least 30 minutes between 10 a.m. to 3 p.m. is what is recommended. Next. Next. So exercise plays a very important role in bone and muscle health. So both all weight bearing aerobic exercises, strength training resistant exercises, and balance exercises they should undergo. So weight bearing exercises should be done at least 5 days a week. So whatever is possible for the patient, we have to encourage them to do. Even treadmill, jumping, dancing. So whoever can swim, they can swim. So whatever is possible, we have to do. So not every exercise can be done by everyone. So strength training and resistant exercises, previous slide, should be done at least twice a week. So balance exercise and function training exercises are very important to prevent fall. Yoga is preferable because it increases the flexibility and balance. So in the case of sarcopenia also, as I told, the physical activity, exercise, and adequate nutrition will play a main role. So for having, we should try to build the muscle strength, muscle mass during childhood. It has to be maintained during midlife, and we have to minimize the loss in the adulthood. So not only vitamin D and calcium alone is sufficient. For muscle health, we require other micronutrients like magnesium, selenium, vitamin C, and vitamin E is also needed. Next slide. So there are various exercise programs which advocate, which have been promoted to improve the muscle health. Next slide. So vitamin deficiency is very common in India. So we have to correct the vitamin D deficiency, followed by maintenance therapy should be given throughout the lifespan. Next slide. So Dr. Elaverson has already told us about when to start the pharmacological treatment for osteoporosis. So you have to start when the T-score is less than -2.5, when there is fragility fractures, when there are multiple risk factors. If we don't have bone mineral density, we have to do the intervention individualized based on the OSTA score and the FRAC score. Next slide. So for prevention of osteoporosis, hormone therapy may play a main role. For prevention and treatment, bisphosphonates and SERM. And for treatment, Sir has already discussed about the other options. Next slide. So hormone replacement therapy should be given for prevention of osteoporosis in women with the premature menopause and early menopause. So it has to be given up to the natural age of menopause. When we are starting menopausal hormone therapy, it has to be started within 10 years of menopause to have the effect. And first line treatment when there is associated menopausal symptoms. After 60 years, it has to be a shared decision. It may not have its full benefit. Next slide. So for bone and muscle health, we also should follow fall prevention strategies. So already exercise, we have told about balance exercises and strengthening exercises. So patients who are on medications, those medicines should be reviewed, and home modification should be done to prevent fall. Vision correction should be done, and vitamin D supplementation should be given. Next slide. So bone and muscle, they function as a single metabolic unit. So we have to do mechanical loading will stimulate bone formation. So we have to do strengthening exercises to promote bone formation. So myokines will influence bone metabolism. Osteokines will improve the muscle function. So we have to follow a combined approach with exercise, nutrition, and pharmacotherapy to have best effect, best benefit. Next slide. So the take-home message is you should aim to have a good peak bone and muscle mass. We should identify the risk factors. We have to predict the risk of osteoporosis and fracts by simple tools. We have to follow suitable prophylactic and therapeutic management. We should follow a bone-friendly lifestyle. So prevention and early detection is the key in the management of bone and muscle health. Thank you.
Thank you, madam, for your insightful and highly informative session on bone and muscle health. The talk was really engaging and enlightening and was very relevant to our daily practice. Thank you, ma'am.
So thank you all speakers. Now we go to the next program.
So next program, actually, we are just added Foxy No Violence Committee chair, Dr. Jayarani Kamaraj is going to talk about the how to end, understanding the ways to digital violence against older women. So in elderly women, the digital violence actually our till December 10th is our days for violence against women, especially for cyber crime and all. So I'm happy that Dr. Jayarani is going to tell about the understanding the ways of when over to the Dr. Deepika, just you can read about Dr. Jayarani Kamaraj.
Yes.
CV is there?
Yes, ma'am. 1 second.
So we have deviated from the osteoporosis and we have added this talk just because it's a no violence against women. The WHO day is on 25th November, but till 16 days after that, they are having it against no to violence against digital violence against women. That is the thing. So because December 10th, we thought one talk will be by Dr. Jayarani on this.
Ma'am, thank you, ma'am.
CV Illappa?
Shakti, you have the CV?
Yeah.
Yes. We welcome Dr. Jayarani, ma'am. She has been a senior consultant of reproductive medicine, infertility and sexual medicine, Director Akash Fertility Center and Hospital, Chennai. She is also the president of Oxy Treasurer, Tapisar. She is an associate secretary, World Association for Sexual Health Advisory Council member, World Association for Sexual Health. She's a joint organizing secretary, ISAR 2015, member of Board of Studies, Dr. MGR Medical University, lifetime member of FOXY, lifetime member of American Society of Reproductive Medicine, member of European Society of Reproductive Medicine and Embryo. And she has been a recipient of many awards. She has received the Best Doctor Award by MGR Medical University, Chennai, and Rajamani Janakiraman University First Prize in Gynecology and Obstetrics. Dr. Vadamalayan Endowment Gold Medalist in MBBS Obstetrics and Gynecology Examination. Dr. Anantachari Prize for being University First in Medicine Gold Medal in DGO Dr. MGR University Exam. She has been awarded the Women of the Year 2010 by the Lions Club. Achievement of Yeoman Service Award by Ex-Nora 2010. Mega TV Women Achiever Award in 2011. Nalam Hospital Women Achiever Award in 2011. She has received the Best Paper Award for Sexual Health, Sexual Dysfunction in PCOS in Fetal Women, AOFSS 2016 in South Korea. We welcome you, ma'am.
Thank you, madam, and a very special thanks to Chennai Menopause Society for giving me this opportunity to speak on a topic which is very importantly prevalent now, the 16 days of activism we are doing. And I'm very thankful to our president, Dr. Premlata, and the secretary, Dr. Deepa, for giving me this opportunity to talk on this day about this important talk. That is, we are doing the 16 days of activism from November 25th to December 10th. So I just requested madam to include this, and I'm very thankful, ma'am, for including this topic. And I'm really honored to talk on this very important content. That is the the abuse of digital abuse, how an elderly face, because we know pretty well this year the theme of this International No to Violence Against Women's Day celebration has the theme of Unite to End the Digital Violence. That is the very important theme that we have. So what I thought is, even for our elderly women, we have a lot of digital abuse. So it is our responsibility as a gynecologist to know what are all the digital abuses the elderly can go through and how we can prevent it, and what are all the things that we can do to protect them and educate them, so that the elderly can have a safe cyberspace. Because this manosphere, what the WHO Secretary General says, it is the one which is now going to take the whole world into it. Everything is now under digital world. So you can't have anything without a digital world. Though they have a good thing, there are a lot of negativity also about that. So that is why this year they made the digital safety is the very important one, that everyone should be aware. And the violence and the crimes which are increasing, one side we see a lot of decline the crimes because of lot of protection, lot of gadgets to identify and detect and to prevent. But at the same time, there are some amount of harassment, some amount of cyberbullying, and about of lot of stress created through the social media. It is now entering into the house. So that is why this is a very important aspect that we all should know. And definitely elders have to be aware of how they are being affecting, I mean, how this digital world can affect their personal life and how they can protect themselves. That is why I'm here to talk on this day of the last day of the 16 days activism. I just want to talk about how the digital world is affecting the elderly and how we can protect them, and what are the way forward that we can do to prevent this from the elderly being affected. Can I share my screen, Saiti? Can you see my scan? Can you see?
Yes, ma'am.
All right. Okay. So I should make it as a
Full screen, ma'am.
full screen. All right. I'll do that. Is it okay?
Yes, now it's in full screen.
All right. Thank you. So we know the digital abuse in older women. So we have seen a lot of abuses among the younger people, adolescents, school children, but the elderly also is being abused by this digital world. So elder digital abuse includes, that is actually a misuse of the digital technology that harms, exploits, manipulates and intimates an elderly person. It can occur through any way, through their mobile phones, because no one is there without a mobile phone. Every human is now having, even from 5 years to 90 years, everybody has a mobile. So there is a lot of impact of this mobile phone. The exploitation can occur through mobile phones, social media, through the apps, and also lot through the bank OTPs, WhatsApp, email and online portal. Because many a time this elderly, they don't know how to handle this, and that is why it has become now a very important form of an abuse. When you look into the data, I'll tell you the data about this in the next few slides. This is happening very much in the older adults. It's rapidly growing form of violence, especially through the smartphone dependency, mainly for online banking and all online apps, ordering, online getting things. Everything is online. So definitely has a very great impact on the older adults, mainly through their dependency on the smartphone and online banking. While physical and emotional abuse have long been recognized, there is a upcoming cyber violence and online harassment, frauds, digital exploitation are now emerging as a major threat to the elderly safety. So we know pretty well, we think that the girls and the young women are more exposed to certain form of cyber violence through cyberbullying, non-consensual intimate image abuse. These are very commonly seen in the young women and young girls. But if you look into the older women, they are more vulnerable for identity theft and cyber harassment. So these are the very important one the older women face through, and they are very vulnerable. When you look into the prevalence, when you see the global trends, The seniors are the fastest growing victims for this online fraud. The FBI IC3 report 2023 says adults more than 60 lost nearly around 3.4 million US dollars to cybercrime, which is definitely a rise of up to 84% from the data of 2021. So much rampant within 2 years. Average loss per senior is up to US dollars 33,000, if you just imagine. So is it there in the Western world? What about the India? Yeah, we also have a data. The Indian Cybercrime Report, that is NCRB 2023, states that 52,000 of digital fraud cases are targeting seniors annually. 40% involve their UPI account, OTP, WhatsApp frauds, which is usually through that they reach these elders. And there is a survey in Helpage India, which is very much published in the Times of India in 2023-24 survey, states that 72% of elderly internet users reported experiencing digital harassment or fraud attempts. 29% lost money through the digital scams, and 54% feel unsafe using online platforms. And if you will see into a data from RBI Ombudsman data, that is, it is actually a very important data from RBI. They say that highest rise in victims are over the age of 60, mostly due to UPI linking, KYC frauds and phishing. So this is what the very important one. So in Tamil Nadu, especially in regional Tamil Nadu, especially in urban India, if you see, there is very much in the higher level, 16 to 18% of cybercrime victims are older adults. 60% plus they group, this type of a group of people loses very much higher financial amount per case compared to younger victims. So that is the latest data from the why these elders are vulnerable? Mainly because of digital illiteracy. When you look into our grandmas and even ourselves, we are not that best when compared with your younger teenagers or even your younger grandchildren. So they are very much updated with the knowledge of the digital literacy. But elders and olders, they lack the digital illiteracy because they know very less about the apps, links, pop-ups, OTPs. They don't know much about all these things. So that is a one important digital illiteracy. Second, they are many times alone. So they even more likely to respond even unknown callers, and they always may get into the scams very easily. And many sweet talks, very much caring talks, very much soothing talks will give them more confidence in the talking person, and believing is very, very common. And also another one is their cognitive decline, the memory issues. They can be easily manipulated because of these memory issues, because many times they may say okay, tell me the UTP, I'm so and so, you have to tell this, I'm a bank manager, I'm looking into your this property. If there's something they forgettively, because of their cognitive decline, they can be easily manipulated, and their OTPs and UPI can be shared very easily because of this memory issues. And of course, the financial dependence or rather independence, because many times they have very good money and value, so automatically they are so independent, so they can handle their own pensions and savings, which are very much online. They have more, and thereby they are the largest targets. So that is also one important way. And next is, the elders are very trusting natures. If someone talks very kind to them, very much lovely to them, affectionate with them, they tend to believe. And they don't know, even they believe the official ones. Even educated people who are retired educated people, they were very much believe that official looking messages and try to respond to it, and they think it is an official government messages. So because the fake messages, they don't know how to differentiate that, so they trust it, and then they get into the trouble. So this is one thing. Then the third and a very important one, the family perpetrated digital control. That is, their password can be easily thefted, and the relatives or the kids and kins can use their digital platform or their account by getting their password, taking their ATM, taking their UPI access. All these things are possible through the family perpetuated digital control, and their monitoring phone, they can check it easily and get easily others. And also they can even block them if they really want to complain or to ask others, or even ask some people who are really known to them, they can block with others also. And of course, the rapid technological changes, because many times it is very difficult for the seniors to adapt quickly, and this make them a difficulty to make it easily adapting to the newer apps, and that will be easy for the scammers to exploit this lag. So the digital abuse includes online financial frauds, phishing is they believe them, they make them trust them, and then they get their OTP, their WhatsApp account, OTP scam, everything, causing a fake people like their known people or relatives or officials, and easily they cheat them. That's how the phishing, cyberbullying, intimidation, threats, data misuse, identity thefts, online romance scams, and forced digital dependency. So this is the way that WHO nowadays says that the elderly face this scam more than the younger people, and it is always more a psychological and financial exploitation the elders face through this abuse. So phishing is a first, it is actually a cyber crime. The objective is to get the people to reveal sensitive data by getting their very much confidence, and thereby making them get their accounts detail, everything. That's called the phishing. So what are the common things is the financial, they create a fake KFC update call. If they are into even a bigger well educated person, if they have their KFC or their stocks and their investments, they make a fake KYC update call, make them feeling that if they are in the, we have to update your call, give your email ID, get this video message. So never respond to the fake or the KYC update calls unless otherwise you are very clear. Second, the collect request scams, collecting the money, I'm for this and that, making them feel that that's something that they have to get from them, and thereby cheating them. Pension and bank account verifications, saying that verification they have to update their age, update their proof, updating their life longevity, update whether they're alive. All these things will make them fake and make them go into the financial scams. And of course, WhatsApp impersonation, because definitely all the, pretty well the hacking your like any of your relatives asking for money. Then OTP password threat, we know elders for OTP claiming to the bank as a bank and customer care, and thereby all their GPay, all their online banking, everything can be hacked. That is also possible. So online harassment, bullying, especially through repeated threats, blackmailing them, abusive messages to make them go for a mental stress, depression. All these things are possible through online harassment. And impersonation, especially by creating a fake government schemes and asking them to put into it and helping them, like very much like helping them, they make into this, get into this scam by impersonation and social engineering, which is fake insurance updates. Like they also even get into their good books like romance scams, and they are very much vulnerable to it through Facebook or WhatsApp, and that is how they get into their personal life. And even tech abuse through the family, that is a coercive digital control by the family. They get into their passwords and they block their financial accounts, and they even track their accounts, track their calls, track all their money exchange, online track everything they can do, and thereby they can, even the family people can abuse them using the technology. So it is not only the financial loss, but it also affects their mental and physical health. There comes our role as a health personnel. We are there to support them, because many times it affects their physical and mental health. If they lose their money, if they are harassed by cyberbullying, if they are faked by some account blocking, or if they don't know what to do, how to answer, all these things will make them go for an anxiety, panic, guilt, and all their metabolic problems gets worsened, like the diabetes and worsening hypertension. They go into sleeplessness, depression, social withdrawal, and sometimes even mistrust on the closest people also, and they don't know where to ask the help, and they stop asking others help because they are very fearful, and sometimes even very severe suicide attempts in severe financial losses has been even reported. So in 2023 HelpAge India survey says that 43% of elders report extreme stress because of the digital fraud, and 31% stopped using digital services because of this. Even their increasing isolation mainly caused by the stopping of the digital services. They won't they won't use the phone, they won't use the WhatsApp, they won't a video call, fearing of this being a harassment and the cyberbullying. They stop using it, and thereby they have an increased isolation. So what are the warning signs when an elderly in the home? What are the warning signs that we as a doctors and caregivers should notice in an elders is they suddenly get stressed and anxious about phone calls. They never take the phone call, they never answer the call, they don't even pick up the call, they shut down the phone and they keep it on close it. I mean, keep it in mute. They won't even attend the call, and they're stressed. And sometimes without their unexplained financial withdrawals, we should be very careful. If they have any financial withdrawals, they may be giving someone for harassment, or they may be losing it without their knowledge. And fearing of using a smartphone, that is also always they will keep it very safe, thinking that they can be hacked, and also repeatedly telling that someone is asking for OTP and sudden banking online. All these things should suspicious that they are into some problem. And also if they are complaints, they may even have a complaints that the family is controlling them by phone, or the phone is controlling through them. All these things can be a very important warning signs for any healthcare providers. When they get into a known elderly, when they have all these conditions, then we have to be suspicious that they may have a problem of digital abuse. So you can definitely implore into them and get their advice. And next is how you are going to prevent, and the protect strategies are very important. You must tell the elders, never share your OTP or your PIN number of your account or your CVV of your credit card to anybody. That is very, very important. Do not link any links in the SMS or WhatsApp. Never do it. Whatever it has given as a caption, never click a link. Use only official. Make sure doubly check with your friends if it is a pension, or if it is something a renewal of your pension, or it is a renewal of your fixed FD from the bank. Please verify with the bank manager and then use. Keep your phone always locked with PIN. Use the UPI safely. Also disable the auto pay, which is very important. The auto pay, tapping your credit card, everything you have to be very careful. Avoid posting your personal information in social media. Whenever you have any suspicion, immediately report the suspicious message to your close kith and kin immediately. Second is the families. It is for the individual. Family, teach the digital skills step by step to the elders. That is very, very important. The HelpAge India, they have started a class for the elders to educate them about how they can use the digital world very safely. They are doing on classes for these elders above 60, where they teach them how to use their smartphone, how to use them safely. So definitely there should be a fraud alert in the banks. You have to keep it in your mobile, which will give you a alert. If you are withdrawing money, definitely they will alert you, and thereby there can be a possibility that whenever they know about it, automatically they will check their accounts. Of course, enable two-factor authentication for any of your mail, any of your transaction. Enable two-factor authentication and use a trusted contact in banking apps. Never just like that. The banking apps, never believe that. Encourage many times to discuss any suspicious call. So the family, you have to educate them. Don't, if you have any suspicion, immediately tell us. Protect them so that it will be easy for them to immediately go and report to the son or the daughter or the husband that something is happening in this call, kindly attend to it. Immediately block the number, tell them, so that you can be very sure. So this is for the families to educate the elderly. And of course, the community level, we should have a digital literacy clubs. That is what the HelpAge India is doing for many of the senior citizens. They have a class for them how to use their smartphone wisely and how to use the app, so how to download it, everything they are educating them. And of course, awareness sessions in the common places, especially the temples, in our health sector, the primary health centers, in the hospitals, everywhere we have to teach them about the awareness. And we have to put the posters in the bank and the post office what they should do as a protection strategies about the bank proper number, how to get everything through the bank, OTPs, everything we should be alert. Of course, the college students and volunteers should educate to get the volunteers to teach the elders, which is very, very important at the community level. And of course, for the healthcare providers, we should screen digital abuse during our routine visits of the elders. Ask a question whether you have any problem with your digital use. Is there any problem? You can even ask them simple questions. Simply ask them, has anyone asked for your OTP or your PIN number or your CVV? If your credit card, never tell them. Always tell them, is there any problem is using their phone. If they have any problem, please educate them. That is also very important. Provide helpline numbers. What are the cybercrime numbers where they can immediately report? That numbers, you have to educate them. Of course, there should be a social worker or a cyber cell. You have to give them, whenever you have a problem, please report to the cyber cell number or the cyber cell person who can help you. That is also very important for ourselves, for healthcare providers, to educate, to prevent and to protect the elders from the digital scam. And legally, India has very many methods, especially the cyber crime helpline number is 1930. We should put it everywhere, even in the clinic, wherever the public or the common people are seeing, you have to put it so that any people will be educated to know about this number. Immediately call this number to report a cybercrime. And the cybercrime.government.in portal is the cybercrime portal line, where you can immediately lodge a complaint whenever you feel any misuse or any other problem regarding your digital conditions. You can immediately put your complaint into the cybercrime.government.in portal. And even for the RBI, we have to check for even you may think that RBI are very genuine, but sometimes even in the fake way, RBI also they may use RBI also for the fraud. So never think that RBI are very liable. Even they, through RBI name itself, they can cheat you. So immediately please report, even if you feel any problem with the RBI. And of course, Senior Citizen Act 2007 can apply if family misuse digital access. So any of the family members makes this digital access and make the abuses against the senior citizen, there is an act, Senior Citizen Act, which very strongly make this as a great punishment for the people inside the family who misuses the digital access of the senior. So way forward, we have to strengthen the digital literacy. We have to improve the awareness about how to use all these things through even a healthcare groups or in a common public places. We have to build a safe reporting environment, encourage the seniors to speak without fear or shame. We have to have an elderly friendly counters in the bank, in the public place where there is a digital things are used. You have to give them a elder friendly counters, and also technological solutions like how to block the spam call, how to detect the fraud calls, and how to detect the fraud detection apps. All these things has to be installed in the elderly phones apps. And we can even have an emergency alert buttons for the elders to prevent or to notify whether when they have any problem related to the digital abuse. And of course, in the routine history taking in our geriatric care, we should include history taking along with the physical and emotional financial abuse should be included in their routine history taking, especially in the geriatric care. And social support, whenever they are very much isolated, they get into the trouble, because when they want to connect with the outside world, they always use the digital world. Automatically they can be cheated in that. So whenever there is a isolation of an individual, try to make them with someone who can be helpful. That is a very important one. And of course, adopt senior platform, which is very important to help the seniors, which can promote them to have a proper helpline for this digital, for using the digital health program. So to conclude, digital abuse is of course the fastest growing form of violence against the elderly. It steals not only their money, but also it causes a lot of problem related to the dignity, their confidence, and also a lot of emotional health, stress and anxiety. And of course, with awareness, with their education and early reporting, and with the community support, many a time the scams or scams are preventable. And the key is to empower the seniors with knowledge and ensure they never navigate a digital world alone, but with a proper family and the societal support. So with this word, I thank you one and all. And these are the references which I've taken. And I thank Chennai Menopause Society for giving me this opportunity. Thank you so much.
Thank you, ma'am. Thank you so much. That was very, very interesting and informative, madam.
Really, I think we must congratulate her for selecting this topic, which is really very important for our menopausal women. So many new things, Dr. Jairani, you have brought to our notice, because we always think of osteoporosis, hot flashes, so many blah, 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 these things. But this is a way out of the way you have spoken, which actually opened my eyes also, because geriatric population now, they're increasing more and more every day. And everybody is using, as you said, from 5 years to 90 years. And I also get at least spam calls, minimum 4 to 5 from Airtel or something, somewhere. We don't actually answer the calls, but it's really nice eye-opener, I must say. Congratulations. And I think we should go on repeating this in every our menopausal meeting at the end.
Yeah.
And
Thank you,
you
ma'am.
have
Thank you,
really
ma'am.
agreed and brought this lecture, Dr. Premlata. Congratulations for you also. Entire session is very, very useful. Thank you very much. Entire Chennai Menopause Society and Dr. Hepzibah, and of course, every speaker has done their job very excellently. And the cream and the cake is Dr. Jairani's. Thank you very much.
Ma'am. Thank you, ma'am. Thank you so much.
We have never been exposed to such type of talks so far.
Exactly.
So it's really a new thing, and we are very happy.
So much is there. She has collected so much literature on that, and she is really enlightened. Thank you very much.
Thank you, ma'am. Thank you, ma'am. So good evening, Atul sir. Good evening.
Enjoyed the whole session.
Thank you, ma'am.
Very
Thank you,
excellent
sir.
talk by each and every.
Thank
All
you,
the
sir.
best to Chennai Menopause Society.
Thank you, sir.
Thank you, sir.
Thank you.
Bye bye, Dr. Lakshmi.
Thank you, sir.
What are thanks by?
Yes, ma'am.
madam.
Thank you,
Okay.
everybody. From behalf of the Chennai Menopause Society, it is a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first start by thanking the Almighty for making today's occasion a renowned success. I take this opportunity to thank one and all. Firstly, I would like to thank our Chief Guest, Dr. Atul Munshi sir, and our guest of honor, Dr. Lakshmi Ratna ma'am. It was a great pleasure to have you all today. And I also like to thank our President, Dr. Premlata ma'am, and our Secretary, Dr. Deepa ma'am. And I also like to extend our thanks to our chairpersons, Dr. Geeta Lakshmi ma'am, Dr. Ramani ma'am, and Dr. Rajalakshmi ma'am. And the day wouldn't end without thanking the guest speakers, Dr. Kannan sir, Dr. Kartika Prabhu ma'am, Dr. Ilvarasan sir, and Dr. Jairani ma'am. Thanks a lot for making this day a success. Thank you all the delegates and the faculties. Thank you everybody, ma'am.
Thank you. Okay. Thank you. I think we can move on. I believe.
Thank you, madam.
Thank you, madam.
Thank you. Thank you. Thank you,
Thank you,
Anupama, for
Sahiti.
all
Thank you,
coordinating everything as a convener. Thank you, Anupama.
Thank you so much, madam. Thank you so
Thank you,
much.
ma'am. Thank
Thanks,
you.
Jairani.
Thank
You
you, ma'am.
added
Thank you, ma'am.
spice at the end of the thing. It was a new.
Thank you, ma'am,
eye-opener
for
thing.
giving this day. This is the last day, so I want to do it with the Chennai Menopause also.
After you told only, I just was going through and I found that 16 days of activism after 29th of.
Yes, ma'am. Yes, ma'am.
Thank you.
Thank you, ma'am.
Hepsi, anything? Hepzibah?
Hepsi, ma'am.
Muted.
Unmute, ma'am. Hepsi, ma'am, unmute.
Hepsi, unmute. Okay.
Okay, thank you, ma'am. Now, madam.
Hepsi, you are telling anything?
No, it was a wonderful session. All of them did job well. And as Lakshmi was telling, Dr. Jairani's talk was wonderful.
Thank you, ma'am.
And
Thank you so much.
it's a need of the hour.
Yes,
actually.
ma'am. Yes, ma'am. Thank you, ma'am. Thank you,
That
ma'am.
gut microbiome was so elaborate. We don't know many things and all. It has been very, really interesting. All bone and gut health and also liver and all. Everything was very nice.
Thank you, ma'am.
Okay, let us.